So we now have 63,497 confirmed cases and 5,947 deaths due to COVID-19 here in the state of Michigan. As the governor mentioned, after several weeks of declining cases and a plateau, we're now seeing an increase in cases in every region of the state. Now, these increases look different depending on the region. So the Lansing region has seen an increase in new cases to over 40 cases per million people per day, which is one of our cutoffs. But the percent of tests that are positive remains low at 2.8%. The Grand Rapids region has also seen increasing numbers of cases over the past 2 weeks and is now seeing over 20 new cases per million people per day. The percent of tests that are positive in the Grand Rapids area is also increasing and is currently at 3.4%. This is concerning. The Detroit, Kalamazoo, Saginaw, and Jackson regions have seen increases in cases over the past week, but they all remain under 20 cases per million people per day. And these regions also have a low percent of tests that are positive, below 3%. The Traverse City and Upper Peninsula regions have also had increased case counts in the past week, but they continue to overall have low cases and a low percentage of tests that are coming back positive. So there's several reasons for the increase in cases that we are seeing across the state. Some are associated with workplaces, such as farms. Others are associated with individual parties, such as weddings or other celebrations. And we know of an outbreak, as the governor mentioned, with a bar in the East Lansing region. And we are seeing some cases still in nursing homes. There's also evidence, however, that there is likely community spread going on in some areas of the state. And I really want to take the time to commend our local health departments for quickly identifying and responding to these outbreaks across the state. Hospital utilization in the state has remained steady, with about 80% of total inpatient beds across the state occupied. So that includes both COVID patients and non-COVID patients. And we continue to monitor hospital bed capacity across the state. It's also important to note, as the governor mentioned, we are also looking at a changing age distribution of cases in the state. So early in the outbreak, most new cases were occurring in people who are under the age of 50. But in June, that changed. The rate of new cases is now higher for people under the age of 50, and in the past 2 weeks, the rate of new cases is highest in people ages 20 to 29. 23% of cases in the month of June were in this age group, 20 to 29. So this is very important. Everyone, including young people, need to understand that they are not immune to this disease. Not only can they spread it to others who are older, may have underlying medical conditions, or are likely to get very ill from the disease, but young people themselves can still get very sick from COVID-19, and they can even die from COVID-19. So I implore everyone, please take this seriously. Socially distance, wear a mask, avoid large crowds, take responsibility for your own health and the health of your community. This is not a joke. As we re-engage more sectors of the economy, Michigan is also continuing its work to expand testing access and encouraging Michiganders to get tested. So over the past week, our average number of daily tests has risen to nearly 16,000 tests per day. We want anyone who needs a test to get tested. So if you feel sick, if someone close to you is sick or has symptoms, if you work outside the home, please get tested. We have also developed tools to make it easier to get a test. There are dozens of test sites in Michigan that offer testing at no cost, test people who don't have symptoms, or they do not require a doctor's order in order to get tested. So you can go to our website, www.michigan.gov/coronavirus test, to easily identify one that fits your needs. You can also call our COVID-19 hotline at 1-888-535-6136 for help finding a test site. We have a new partnership with Michigan 211, and anyone who calls the hotline and presses 1 will be transferred to a 211 operator who can help find a testing site, and for certain sites, they can even help you schedule an appointment. So please do utilize these resources. Our goal is to make it as easy as possible for people to get tested so that we are better able to contain the virus. So along with testing, as we've talked about a lot, contact tracing is another critical aspect of our state's response to COVID-19. So in this process, state and local public health staff are reaching out to those who have tested positive for the virus and identifying who they have been in close contact with. We are seeing the average number of contacts per positive case rise. Earlier in May, the number of cases with contacts was about 3 on average. So today, that number is 4. As the economy more fully reopens, we expect confirmed cases to have larger numbers of contacts. So we need everyone to do their part to make sure that contact tracing works and that we can notify everyone who may have been exposed. So when you see a phone call from a state or local public health staff, please pick up the phone. We won't ask for any social security numbers or banking information, but it's really, really important that we get the names and information of people that you may have been in contact with if you tested positive. And we may also be calling to tell you that you came in close contact with someone who has the disease. So this is the bread and butter public health work that simply has to happen if we're going to effectively contain COVID-19. So please do answer the phone. And if we give you guidance on needing to quarantine or self-isolate, please do your part and follow the guidance. We all have a role to play in saving lives. I was honored to play a part in developing the My Safe Schools Return to School roadmap that the governor announced today as part of the Return to Learn Advisory Council. I myself have 3 school-age children, and I want nothing more than for them to be able to have in-person learning in the fall in the safest environment possible. But for them to be able to do that, as the governor mentioned, we all have to do our part. We have to get this right. Just one person can spread the disease to many more. The disease can spread like wildfire in our communities. And what we saw happen in the spring when our hospitals were at capacity and deaths were high is something that none of us wants. But we still have time to avoid a surge in cases. So I implore everyone again to please take this seriously, wear your mask, socially distance, and be responsible. We still have a long road ahead of us in fighting COVID-19, and we must remain vigilant.